I'm going to zip through. I've got about 5 slides, which is perfect since we have very little time. And I know everyone has traveled. Lots of folks have traveled to get here. So let's just kind of get this through. I don't need to hear myself talk. So that's a good thing, right? Let me introduce myself really quick. My name is Chris Wolf. I am actually the CEO of TIL Consulting, which is a group I started 4 years ago. What's probably more important is my background. Before I started my consulting group, I left a company called ViaQuest. Some of you may know ViaQuest. They're an IDD, behavioral health, home health, hospice, kind of a full continuum of service provider. They're based out of Dublin. They, at one point, were in 3 different states. I'm not sure where they're at these days. When I left as the chief operating officer, I was doing behavioral health. I was doing residential. There were services in Indiana. There were services in Pennsylvania. One of the things that I did for ViaQuest that I think is important to stress here is that I initiated their behavioral health program in about 2007. They did not have behavioral health services at all. They were predominantly an IDD provider. I bring that up because we're going to talk kind of big picture, but I want you to understand that I've actually developed a clinic from the ground up and did it for IDD and clients, as well as then getting into services for kids and other adults, et cetera. When I left the agency, we had, I believe, 4 clinics across the state serving about 2,500 people a year. So I get the details. I really do. Today, though, my presentation is about strategy. And what I want to kind of stress is, first of all, this is the world according to me. So I'm up here talking. I get to define how I want to define things. And you don't have to agree with me, but it's important you understand what my perspective is so that we don't get confused about what I'm talking about and what I mean. A lot of what we talked about, I kind of alluded to it earlier, to me is survival. A lot of what you guys have been talking about today is survival. It is where things are today in our system. We can highlight or point fingers and say this is wrong or this is good or this should be changed, and all that will occur, as we all know. But it's survival. It is the system has transitioned, and this is the aftermath of that transition. This is a big, big, big thing as far as behavioral health in Ohio, and to think that it was going to go smoothly, well, you have leaders in your association and other places that knew it wouldn't, and that's why they are tirelessly working to just try to keep trying to iron out the wrinkles, if you will. So all I wanted to do, again, is stress that we're going to talk kind of high level. We're going to get through this really quick. I wanted you to know a little bit about my background. I'm actually a trained clinician. So my master's in counseling, got it from the University of Dayton, go Flyers. I've done therapy. I'm no longer licensed. But I have a pretty varied background. As the COO of a large organization, I had to deal with a lot of the details with finance, with programming, with compliance, et cetera. But if you are here today and you don't understand how you got here or that today was going to happen, what I'd tell you is that someone wasn't really thinking strategically. No one understood exactly how this was going to roll out, other than it wasn't going to be perfect, that there was going to be a lot of back and forth. Part of any good strategic plan would be to make sure you're a part of your trade association. That's a plug wherever Teresa's at, because you can see the work that they do on behalf of all behavioral health providers. Whether you're a provider, a member or not, there's tons of work that gets done, right? And the last thing that I wanted to say, and I'll dive right in here, reflecting on the whole day and thinking about strategy. I know there was a show of hands of how many folks here are clinicians versus how many folks are billers or how many folks are executive directors or CEOs. At least when I opened up clinics, the vast majority of the people that we hired were therapists or psychiatrists. They weren't billers. They weren't the managers or the directors. And if I had to, as part of orientation, bring my therapist through today and be here as a training, they all would leave because this was awful. I mean, this is just truly, if you're a therapist, to have to sit through what you have to sit through and understand coding and things of that nature, I'm going to tell you that if you haven't thought strategically as an organization how we're going to try to raise the bar and bring our therapists along, you ought to be thinking about that. Completing a plan just last year, feedback I was getting from the clinical team was, when I go see my supervisor now, all we do is talk about productivity and utilization. I want to talk about the case. I want to talk about clinically what I should be doing over here. And they weren't being Pollyannish about it and saying that they have no responsibility when it comes to productivity and understanding how their work product impacts the mission, impacts the business. But what they were saying is that this balance was getting a little out of hand and that they weren't getting what they needed as professionals. And to try to translate everything that was going on today to them is a very, very big task. And hopefully your organizations are thinking about it, because the rubber hits the road is with the outcomes and the clinicians. And if we can't figure out how to make all of this very complex goobly-gook, and I use that term because, again, I've been there, I understand it. I'm just trying to say, and what people are going to hear, they don't want to hear 837 codes and things of that nature. And you got to be thinking about that strategically, how you're going to bring your clinicians along. All right, so that's soapbox. Apologize for that. So to cover some things, as I said, a couple of years ago, if not a little bit, I'd say even 3 or 4 years ago, it was pretty apparent what was going on with behavioral health, in my opinion. I had been working with managed care at ViaQuest since probably 2008. Even though there was no carve-in at the time, we understood very clearly that we could provide something beneficial to managed care, and they could be a very positive stakeholder to what we were doing from our clinic. Fortunately, Emily Higgins, who's still around at Molina, was one of the key people that we worked with there, and several others. But we were very aware of behavioral health a long time ago. And what I'd say over the last couple of years, there's been tons of trainings that I've been a part of. I mean, this goes back 3 or 4 years about prepare. And the problem is, of course, no one knew exactly how this was going to roll out. But we should have been thinking about it. And that's what strategy is about. That is what strategic planning is. So some of these things you've heard before, and heard today, I should say, is 1, know your cost of care. If you guys are hearing that for the first time, sorry, but that has been out there forever. And the idea of knowing your cost of care is something that's going to continue, as you've heard throughout today. And then how do you get at knowing your cost of care? And why do you need to know your cost of care? Knowing your cost of care allows you to advocate. It allows you to advocate for your therapists, advocate for your service, and advocate for your mission. So yes, it's numbers. Yes, it's complicated. Yes, it's going to be all sorts of different things. You may need new resources to pull in so you can get this, but you're going to have to know your cost of care. You're going to have to be able to make your case. And that is something I knew 3 or 4 years ago. I'm sure several of you did. But you heard it reiterated again today. It's pretty much fact now, right? You got to be working on that. Data management, treatment outcomes. I mean, say no more, right? You got to understand, are you achieving the goals that you had in mind? Are you able to show that you have good outcomes? Can you show that? Can you show that after 6 months? I was talking with a substance abuse provider just last week, and they had tremendous outcomes. It was fantastic to hear that. They understand they have very low recidivism rate after their treatment. And they need to know that. They need to be able to show that. Can you show that? Okay? Again, this is the initial trends when behavioral health was about to be carved in. Remove barriers to access. You heard that all day today. Access, access, access. I heard that 3 or 4 years ago. Access, access, access. What are you doing strategically to think about that? Key performance measurements. Operations having key performance indicators. Okay? Do you show up and simply do work? Again, I'm a trained clinician. I've been there. I do that. I like to work with my clients. But do I understand how many clients I've seen? Do I understand how many clients I'm supposed to see? Do I understand how I'm supposed to support them and what kind of outcomes we're looking for? Do I know as a professional what it is you're trying to get from me? Or am I showing up and just doing therapy? If I want to do that, I'll go into private practice. I can kind of create my own thing. If you're in community mental health, man, key performance measurements need to be in play. And they need to be in play beyond just therapy. It also goes into operational things with regards to intake. And it goes into the billing. We already saw some of the slides from Teresa, where if you're tracking what you're getting as far as your receivable and how long that's taking, that's incredibly important to be tracking. And many of you, of course, are. That is, I mean, got to make payroll, right? You got to understand where your dollars are coming from. Okay, so what are some of the new trends? Here it is. You know, redesign hit in January. Carve-in happened in July. What have people have been thinking about this year and maybe just a little bit late last year? So acquisitions, that was also brought up. As part of your strategic planning, you ought to be thinking about this. Either whether you're going to be acquired or whether you think about acquiring other folks. And not just because, but obviously, you know, it has to have some purpose behind it. But I can tell you that, let's see, this is 18, so I've been involved with 3 merge and acquisitions in the last 2 years. And 2 of them already went through all the way through to the end. And then I'm working with another group that's working on an affiliation partnership between 2 organizations. So this is now something to be really thinking about. So this could be affiliations, acquisitions, mergers, however you want to look at it. But this is a strategy to be thinking about. And there's good reasons to be thinking about it. If it's hard to get collections, if receivables are dragging themselves out, and all you do is bill behavioral health, is there reasons maybe you should be looking to do other types of services? Is that really something that you want to do, or can you affiliate? One of the things I mentioned was that I was really positive, really good at was braided funding. So I've worked in IDD, foster care, behavioral health, home health, and hospice. And I can get very clever about exactly how all of these things work together, because Ohio likes to be very siloed in the way that they approach a person. You know, if you're this kind of person, you get this money. If you're this kind of person, you get this money. Kids, oh my God, that's a whole other problem, because you know, the kid, of course, can hit multi-systems. Are they a kid first, or do they have behavioral health? Or do they have IDD? And so braiding all these fundings together actually can be a very positive thing to do strategically. But if it's not something you want to bring in as a part of your mission or expand, what you can do is start affiliating and working with other folks. Collaboratives. I don't know how many are out there. I just threw one up there that I was aware of that came out of, for those of you that are part of the Ohio Child Alliance, there's something that they help kind of put together. I think legally it's separate. I don't want to get anybody into trouble or anything like that, but this is the Child and Family Health Collaborative Ohio. The concept is you have a lot of providers there, and you have basically a voice that's trying to engage on their behalf with payers. I don't know how many of you are part of the collaborative. There are a lot of people that are. And there may be other ones. As I said, that's simply just one that I'm aware of right now. Outsourcing with service level agreements, okay? Some of you might have noticed that the person who did a lot of this work and has been hosting is Teresa. Some of you might know Teresa. I would count that as basically doing a function of your back office, doing the billing. If you sat through these sessions as I did, it is complicated and convoluted. Now, it has always been complicated. Who has ever gone to a party and it talked about what you did and they didn't look at you like you had 3 heads, right? It's very difficult to explain what we do. And now it's just got even more complicated because it's all brand new. We're not even sure what we do anymore if you wanted to explain what's going on with payment and what have you. So one of the things I'd say strategically is to say you really need to kind of think, A, do I need more resources? I mean, if anything, I'd be walking away from today, I'm thinking, wow, I might need another person back there just to deal with the 2 or 3 other things that have been added to the plate of the folks trying to do billing. You know, between credentialing and just the cycle of trying to track all of your reimbursable, your receivables, remittance report. Did you get one? Didn't you get it? Is it over in this file? Is it texted to you? All that's going on with the same group, right, that you've always had. So my thought would be they probably need to bolster that up. Can you afford to keep bolstering that up? And as much as the world has been very complicated and difficult prior to, we're in a Medicaid system, we do behavioral health and other types of substance abuse, there's lots of kind of complexity to that anyway. Can you find enough people with the expertise that's now being asked of you in this billing side of things? And I'm not trying to do a commercial for Teresa. I'm just saying it's very obvious to me that people's mission, if you were to look at your mission and vision, had very little to do with rapid, you know, looking at basically billing and what have you. And so that's something to be thinking about. Have we got to the point where really I should be paying something outside of this and not continue to try to build it? Affiliations or diversification of services, I kind of threw that into acquisitions. Again, it's the same kind of concept. You could be buying someone could be buying you could be looking at diversifying what you provide, or you could try to affiliate. Here's the one to me that was so obvious, and it was said again today. I think Teresa hit on it in her presentation, and maybe Todd did too. This was what was always easy to me back when I was trying to engage with what we wanted to be looking at, and how would we engage with managed care? Well, it's pretty easy to understand what managed care is looking at. First of all, they're accredited. Right? So understand that. Just like you're CARF accredited or COA joint, managed care plans are also accredited. They're required to meet standards and have these kind of expectations that are listed through the National Committee for Quality Assurance. And I just pulled this off, as you can see, 94 metrics, 7 domains of care. I'm sure it's a mess. You know, we've got ours, they've got theirs, all right? So they can feel our pain. But they're also dealing with the quality withhold and sanction model that's now in place in Ohio, right? Or will be very soon. So they're looking at 7-day post-hospitalization follow-up, 30-day post-follow-up from the hospitalization. From there, expedient access to substance abuse treatment post-diagnosis of that need, children's psychotropics, use of antidepressants. I didn't go into detail with that. I'm sure you guys have heard that. But these are the things that basically managed care, if they cannot show positive outcomes in this direction, if they don't have good measurements, they're penalized. If I'm trying to think how I'm going to work with a new payer, I'm going to look at there. That's what's important to them. And heck, some of that stuff's important to our clients. What do you know? So of all the things that we can do, where's the overlap? That makes sense? So know your payer. Have you ever seen their contract with the state? It's pretty detailed. You can read it. You can read exactly what it is that they're required to do. It's no mystery. It's not fun reading, but it's no mystery, you know. I know who the culprit is at the end. So, all right, what am I doing here? So strategy. We're almost done here, which is good. I'm zipping through here. A general rule of thumb, the way I think of strategy. Okay, this doesn't play out all the time, but this is what to me, it's very different to talk about your organization and strategic planning and what your organization is thinking strategically versus process improvement. And I, myself personally, when I'm talking, just to understand me, I break the two apart. Okay? So when I talk about strategy, I'm mostly talking to organizations about addressing things they're not currently doing. Not addressing the things they're doing poorly. And no one likes it when I say it that way. They're like, well, we kind of fundraise, we could do better, that's our strategy. I said, no, that's your process improvement, you suck at it. You know, so admit that and improve it. What are you talking about? You just heard Chris talk about, you know, that kind of concept of constantly measuring what it is. So being a little funny, but strategy for the most part to me when I work with clients is to say, these are the things that you're not doing today. These are the things you're thinking about that you should be doing. And typically the process, if y'all remember what I do with my slides, is to look at, in the end, 4 areas. Okay, and you can call these things any way you want. It's semantics. Okay, but basically, strategically, you look at your market, and you're looking at who you're serving. So your market is the people you serve. And I know that's a very salesy kind of thing, so I apologize for that. But it's just an easy way to kind of put it out there. You know, who's our mission for? Who's our customer? Who's relying on us for support and services? And where do I do it? Do I serve adults? Do I serve children? Do I serve both? Do I serve families? Do I serve folks that have substance abuse issues? Do I do folks with IDD? What is my market? Who am I trying to do it? What am I good at? What am I seeing out there that maybe could change that? And where do I do this? I've always been here. I've always worked here. Is it possible we could be working somewhere else? You look at what and how you do your services. So we've identified who it is and where you're doing it. But then you also go into what is it and how do I do it? Whether it's evidence-based, whether it's changing up some sort of methodology, it's something to kind of talk through in your strategic plan. Obviously, you talk about sustainability. That's the fiscal side of things. And obviously, there's a lot of concern right now as this transition is occurring and as dollars going to flow. But overall, sustainability. And then quality. Basically trying to improve or sustain things that are positive. There's lots of ways to kind of I guess, map out your strategic plan. And the categories itself are less important than the content that you're going to go through. And I go through a really basic thing. It's something you guys can do yourself. And it's just a SWOT analysis. Has everyone heard of SWOT? It's been around forever. It's not complicated. Strengths, weaknesses, opportunities, and threats. Right? Strengths, weaknesses, opportunities, and threats. And basically, you do an assessment internally to determine what do we all believe is our strengths and what do we all believe is our weaknesses. And part of any good planning process is to get people in the room and duke it out. And all I mean by that is someone's going to say, we do this really well. And leadership needs to say, we do not do this very well. And you need to come to some sort of conclusion about what it is that you really feel you do well and what is it that you think you've got some challenges in. And then the opportunities and the threats are all external. That's where you look around and you say, what are the opportunities? What are the threats? And some of them were talked about today, about where we are immediately. But that's a moment in time. And we've got to get through the moment in time. We've got to survive the moment in time. But if you're just paying attention to the bouncy ball right now, and you're not thinking about 6 months from now or a year from now, well, I fear you're going to be back in this with the next bouncy ball that is some sort of disaster that you didn't necessarily kind of prepare yourself for. And so strategic planning is not something that's going to remove risk. And the other thing I tell you about it when I work with my clients is that if you're doing strategic planning and you're not in some sort of chaos mode where it's like, well, we've got to do this today. Strategic planning is really, what I like to tell folks, is about 20% of your work week. When you've set up your plan about things that you're not doing today that you want to do in the future, not improve the things you're doing today because they're poor. That's not strategic planning. That's survival, and that's identifying people who need to be held accountable for not doing their job well. That's different. That needs to happen too, but that's the 80% of your job, right? When you go back to your work after this meeting or this day, it's the 80% that's going to give you a headache, not the stuff that you're not doing yet. And that's kind of how I explain to folks. If you're trying to get something done quickly, understand strategy is not something that people can invest their time in every day. You know, you're trying to bill, you're trying to see customers, you're having staff meetings, you're trying to get your CEUs covered, you're doing the day-to-day things that is your mission. So it's important to have a plan that you can continue to reference, that you can point to, that you can spend your time on, and outline what it is you're not doing today that you need to be doing in the future. And a basic SWOT analysis with some kind of environmental scan that kind of talks about where things are at the federal level, the state level, the community level, and understanding yourself, what you're good at, where you've got some weaknesses at, and what are the opportunities and threats that line up effectively with your strengths and or your weaknesses can really direct your strategic plan. I don't know what I have next here. I said 5. So, when it comes to anything, I'll just throw this out at you for a tidbit. Anything you're trying to get changed obviously starts with the plan. Implement and communicate what's going on, but the last part is the main thing. If you're not measuring it, you're not holding yourself accountable. All right? Create a process that allows you to measure and have correction. Not measure and be held punitively, but measure and correction. It's the same kind of concepts with quality assurance or quality improvement. What did you do? Did you move the needle? A lot of times we just go, we do, and I want credit for doing. And we should get some credit for doing. Doing is hard. But in the end, we got to know if doing was effective. So we can say, wow, we did a lot of hard work, and it didn't seem to do anything. So we got to do some more hard work, but it's got to be different. You're not going to have that conversation unless you're measuring it and identify what it is you're trying to move. All right, I think that's all I got. I'm zipping through here. We're doing good. I got us back on track.
Got us back on track.
All right, thanks everybody.